What causes clogged arteries? You have risk factors for coronary artery diseases such as high blood pressure, high cholesterol, tobacco use, diabetes, a strong family history of heart diseases or obesity. Development of atherosclerosis. Coronary heart diseases is thought to begin with damage or injury to the inner layer of the coronary artery, sometimes as early as childhood. The damage may be caused by various factors including smoking, high blood pressure, high cholesterol, diabetes or insulin resistance, sedentary lifestyle. Risk factors. Risk factors for coronary artery diseases include age. Simply getting older increases your risk of damaged and narrowed arteries. Sex. Men are generally at greater risk of coronary artery diseases. However, the risk for women increases after menopause. Family history. A family history of heart disease is associated with a higher risk of coronary artery diseases, especially if a close relative developed heart diseases at an early age. Your risk is highest if your father or a brother was diagnosed with heart diseases before age 55, or if your mother or a sister developed it before age 65. Smoking. People who smoke have significantly increased risk of heart disease. Exposing others to your second-hand smoke also increases their risk of coronary artery disease. High blood pressure. Uncontrolled high blood pressure can result in hardening and thickening your arteries, narrowing the channel through which blood can flow. High blood cholesterol levels. High levels of cholesterol in your blood can increase the risk of formation of plaques and atherosclerosis. High cholesterol can be caused by high level of low-density lipoprotein (LDL), known as the bad cholesterol. A low level of high-density lipoprotein (HDL), known as good cholesterol, can be the sign of atherosclerosis. Diabetes. Diabetes is associated with an increased risk of coronary artery diseases. Type 2 diabetes and coronary artery disease share similar risk factors such as obesity and high blood pressure. Overweight or obesity. Excess weight typically worsens other risk factors. Physical inactivity. Lack of exercise is associated with coronary artery disease and some of its risk factors. High stress. Unrelieved stress in your life may damage your arteries as well as worsen other risk factors for coronary artery disease. Garlic ginger lemon remedy for clogged arteries. Here is an amazing drink to cure blocks in the arteries. For this we need lemon, ginger, garlic, and some water. Numerous benefits come from the combination of the three super healthy foods. This drink can have so many positive effects on your body. Take few lemon slices with peel. Take a blender jar. Add lemon slices, ginger pieces, and few garlic cloves. Then start blending. After blending, take this mixture into a bowl. Take a pan. Add 1 liter of water. Add blended ginger mixture and boil it for 10 to 15 minutes. After 10 minutes, filter this mixture into a bowl. Let the drink cool down before serving. Benefits of this drink: regulation of increased blood fat levels, prevention and treatment of congestion of the arteries, immune system enhancement, liver cleansing. Drink this water 1 glass every day at least 2 hours before taking food on empty stomach. The combination of lemon and water neutralizes the smell of garlic. By drinking this regularly, you can cure clogged arteries. Thank you for watching this video. Like and subscribe for more videos.